Breast Cancer Awareness Month, and this year there's some controversy over whether or not that self-exams make a difference in detecting breast cancer. Well, joining us now with some insight is Dr. John Shufeldt with Native Air. Welcome, Dr. Shufeldt. Thank you so much for being with us today.
Thank you.
Self-exams long thought to be effective. What's the problem here? What's the controversy?
Well, there's a study that was actually conducted in Shanghai on 260,000 women. Half did breast self-exams, were taught how to do them, the other half didn't, and they looked at what their mortality and survivability was, and what they determined was there really wasn't a big difference. But everybody has cautioned, including the author, that people should not change their practice because of this study.
So you still recommend that women should be doing self-exams?
Exactly. You know, women under 40, they still account for about 5% of breast cancer. And under 40, really mammograms aren't recommended. And the current recommendations are only seeing a physician once every 3 years between 20 and 40 for breast self-exams or for breast exams. So everybody's still advocating that women should examine their breasts monthly to determine, to see if there's lumps or small masses that they can feel.
Dr. Shufeldt, are there any other ways to help detect breast cancer early, especially when things that we've long thought to have trusted over the years are called into question?
Well, I think after the age of 40, definitely. A physician exam every year, a mammogram every year, you definitely need to do that. But I've known many women who felt their own breasts, know their own breasts, and have detected lumps in them that have ultimately turned out to be cancerous. And so, again, nobody's recommending that people between the ages of 20 and 40 stop examining their own breasts because, again, it does count for about 5% of breast cancers that are detected.
You mentioned mammograms, too. I know that mammograms have even been called into question over the last few years. Do you think that that is still the best way to detect breast cancer?
I think at this point there are some other things on the horizon, such as MRI, for example, but I think still at this point mammogram combined with a physician's exam and women's own self-breast exams are still in combination the best thing that we have to offer right now.
Now, you mentioned this also, that women at age 40 are really the ones that need to be having the mammograms done, but women much younger can start doing the self-breast exams. Do you need to ask your doctor if maybe a mammogram is better if you're younger, maybe if there's a family history or something like that?
I don't think they've been shown to really detect any more cancer before the age of 40. However, if you are at risk for breast cancer, in other words, a strong family history, then yeah, absolutely ask your physician. The Susan Komen Foundation, for example, is a huge, and it was just had the run this weekend, a huge supporter and proponent of women's self-breast exams starting when they're 20 years old every month.
And we do want to mention that breast cancer affects men, too. We don't talk about this very often.
Correct. I don't think there's a recommendation to my knowledge about male self-breast exams. There is male self-testicle exams, for example. I've not heard of one for male self-breast exams.
All right,
but
Dr.
that is a rare
Shufeldt,
condition.
Thank you so much for joining us this afternoon. Great information as always.
Thanks.
If you'd like to get more information about preventing breast cancer, or if you'd like to talk to Dr. Shufeldt, just visit our website